Hi, Jerome Fryer here of Dynamic Chiropractic Clinic, and I just wanted to share, well, Happy New Year to everybody. It should be a happier one. I think we're making some progress here. I often kind of peek at patients when they are getting out of their chair to come to their appointment. And it's common. It's common that I see this. I don't always intervene, but I should, and I will more in the future. But I had somebody yesterday sitting. I came around the corner and I said, "Okay, welcome, come on in." And as soon as she went up and she's like, with a smile on, but I could see that the back wasn't smiling. It wasn't. And she kind of get going, and away she goes, right? So one of the things that's important is to reduce the little pain triggers associated with the common movements that we make throughout the day. If you keep triggering the symptoms, you keep triggering or irritating the joints that are contributing to this ongoing back pain, well, guess what? Treatment takes longer. Treatment is not as effective because there are other factors that we could work together to reduce the pain triggers to get you a better outcome. So when somebody sits, the spine goes into flexion, especially with these seat pans, these seat pans that are kind of conventional. The pelvis just has a tendency to roll this way and the spine goes into flexion. And it's kind of hard to continuously kind of combat and try to engage those extensors to create this lordosis. It's better, but when you relax, when you're seated, the spine naturally kind of goes into this flexion state. So when it does that, there is a fulcrum point often with people where it kind of bends more at one particular location. So when the person goes to get up, there is an extra force that's placed on this particular level. Could be up above, could be down below, and that adds to the irritation, the friction that occurs in that particular segment. And here's another model to kind of show you that not all discs are equal. You can see which one here actually moves a little bit more, all right? So think of it like tires on a car. 1, 2, 3, 4. One's a little low, and one actually moves a bit too much. So you want to balance the motion through these segments. So what's the fix? All right? So instead of in a rounded state, instead of kind of going into more of a, so naturally the pelvis kind of goes back like this. So when the person gets up, you're on the end range of that joint. So instead, you want to power through your hips. So you could lean forward, keep this lower back like such, right? Rather than this, like this, and then power with your hips or your buttocks. Boom. As opposed to, okay. The hip joint is designed to do this for us. And here's the femur. All right, so this femur goes in here, and this is designed to rotate. All right? So when you go to get out of the chair, what you want to do is you want to rotate this joint. Rotate this joint. This is where your big power is, right? To help reduce the triggers that potentially could be occurring through the lumbar spine here. So I hope that helps.